Hi, my name is Hadari P.T. Brown. I'm here to talk to you about healthcare reform or universal healthcare, whichever one you prefer. But the reality is we need healthcare reform and we really do need universal healthcare. The only way we can achieve this though is for our U.S. Congress to pass some type of healthcare legislation. Some people wanted us to rush this opportunity. Some people just wanted anything to get passed. No, I've always advocated for smart, sensible legislation. However, we cannot deter from our course. We cannot allow other people to dictate what we need in terms of healthcare. We do need healthcare reform. President Obama and others have started talking about insurance reform. Yes, as a part of healthcare reform, we do need insurance reform, but we also need a public option. We need our government to give us an option outside of the options that we have in terms of the healthcare insurances we currently have. We need a public option where we can buy into some type of healthcare reform that is cheaper, less expensive, that makes our prescriptions less expensive, and gives our doctors the access they need to do the type of work they should be doing to save lives. Healthcare reform is not an easy issue. Don't let anyone fool you. No piece of legislation is ever easy. But what keeps us from getting things done is when people do not work smart and don't use common sense to find solutions to the problems that plague us. For years, they have fought for healthcare reform, and these ideas have been thrown around for over 30 to 40 years. And we are at the point where we are so close to healthcare reform that we can finally get it, but it is people standing in the way. And don't be tricked by the insurance companies and others who have said that we don't do this and we don't do that and we're part of healthcare reform, because they just wanted a seat at the table. So they are actually trying to write the legislation in order to keep their profits high and to keep soaring in the direction they've been soaring in. We can't allow that. We the people have to tell our senators, tell our congresspeople that we want healthcare reform that is smart, that is less expensive, but gives more access to all Americans. That's what we need. It's not hard. It's not rocket science. Our Congress needs to listen to us. We should be mad. Our Congress, if they're not going to buy into the same healthcare insurance that they're going to give us or put out there on the table, then why are they creating it? We want the same type of healthcare reform that our U.S. Congress and the President of the United States have. We want the same type of access to the services and benefits that they have. That's not asking for much. It's really not. We need healthcare reform in this nation, and we need it now. I'm Hadari P.T. Brown, and this is my perspective.